I really liked both speeches, and I must say that in the last 3 years that I'm in Greece, the level of endorsement and deployment of digital capabilities in this country is amazing. So, really well done. I would love to see the same evolution also in the healthcare, trying to help, all the system to be able to bring better solution, better treatment to everyone. I think you touched all the points that are really relevant and important, and I maybe can give a little bit different light on them, right? So I'm not going to add anything new to the equation, because I think all the important elements were already mentioned. But if we look a few years back, we were treating, like you said, we were treating all the patients in the same way, right? We were treating the disease, not the patient. And then slowly we started to use some diagnostic tools. And we started to use them in order to define if the treatment would work for this patient, would be beneficial or not. And now we want to be even more specialized. We want to be more personalized, to look at the patient as a whole. And many times we see the patient only from maybe the diagnostic piece or from the treatment piece, but personalized healthcare per se is integrating all these elements together, from the diagnosis, from understanding their needs, and having enough data in place to be able to analyze and to be able to help our physician not only to use their primary resource of data in order to treat, but also to refer maybe to secondary use of data, where you have a lot of aggregated databases that can help them, and can also help for the industry to identify new treatments, new diagnostic tools, and new pathways in treating our patients. So I think when we speak about the personalized healthcare, we need to have in mind that it is not only about the diagnostic piece, it's not anymore about the treatment piece, it's about integrating all these elements to, first of all, to try and prevent, because as you see, prevention can make a huge difference. Once you get to this threshold of being in this group of patients, the expenses are going exponentially high, and it's really difficult to fix that. But I think currently we have technologies that are related to personalized healthcare, that are related to precision medicine, that can help us identify the genomic profiling of our patients. And it can help us to identify who are the patients that we need to treat and who are the patients that will not benefit anymore from this treatment. So the question is, how much resources are we able to put behind that in order to allow this to be affordable also for Greek patients? Because it might look like a big investment in the beginning, but the value of this and the ability of us to extract data, insights, and conclusion behind it would help all the system in the long run, not only by bringing the prevention and defining what is the right treatment for whom, but also by helping us having the right protocols in place, helping us having the right treatment algorithm in place, and making sure that patients are having the best possible experience in the way they are treated and they are diagnosed and they're having the best prognosis. So I think it's not only one element that can make the revolution. If we want to make evolution, we need to push some different elements together regarding data, the secondary use of data, the use of the different PHC diagnostics and tools, and the ability to bring the medicines to the patients. Currently, we are asking every patient to come to the hospital, right? When it comes to oncology, we want patients to come to the clinic. Why don't we bring the treatment to the patient, no matter where they are? In the island, in the rural area, at home. At COVID, we learned that access could be limited. Isn't that a good enough reason for us to develop new ways that we can treat our patients? And I think Roche currently is putting a lot of energy behind such projects of treating patients at home. And the good thing is, although we didn't progress till now so much, I see a lot of willingness, a lot of openness from the different ministries to really try and push that forward, and we need to acknowledge that. And we here at Roche are super happy to provide any kind of support that can progress these elements and help Greek patients to be able to achieve these elements.